Welcome to the iPod, a new podcast series from Ophthalmology Times where we engage with key opinion leaders in interviews about the latest innovations in the areas of surgery, clinical diagnosis, drug therapy, research, technology, or practice management.
I'm David Hutton of Ophthalmology Times. ASCRS recently held a virtual annual meeting for 2020. Today, I am joined by Dr. Soroosh Behshad, who will discuss corneal crosslinking outcomes in children with progressive keratoconus. Thank you for joining us. Tell us about this presentation.
Thank you so much. So I would like to acknowledge my colleague and lead author on this project, Gina Shetty. Common cause for a corneal transplant in the United States is keratoconus. And keratoconus is generally first diagnosed in young people, usually around puberty or late teens. However, there is a percentage of patients in which keratoconus is diagnosed at a younger age, and the disease process tends to be more aggressive with higher rates of progression when compared to older age groups. Currently in the United States, corneal collagen crosslinking is the only procedure available that may help halt keratoconus progression. And there has been a lot of interest in knowing the efficacy of halting progression, specifically in children, and potentially reducing the need for more invasive surgical procedures such as a corneal transplant. And when reviewing the published literature, there is not that much available in regards to the pediatric population specifically. And so this created our interest and the goal of this project to evaluate the effectiveness of epithelium off corneal collagen crosslinking in children with progressive keratoconus and having 3 years of follow-up. So we ultimately included patients who were under the age of 18 for this study and were diagnosed with progressive keratoconus. We defined progressive keratoconus as greater than 1 diopter progression in the last 6 to 12 months, and all patients had to have a central corneal thickness greater than 400 microns. We did exclude other pathologies that could affect the visual outcome in these patients, such as amblyopia, retinal pathologies, or other ocular infections. Our surgical technique was FDA-approved standard epithelium off corneal collagen crosslinking utilizing the Avedro KXL platform. So our results included 46 eyes that came from 34 patients. 2/3 of the patients were male, and our average age was 15.8 years, with a range of 13 to 18 years of age. Our results found that there was a 2-line improvement in uncorrected visual acuity. This improvement was steady for the first 10 months, following which it stabilized. Our best corrected visual acuity was found to improve in these patients by 2 lines. This improvement was seen over the first 18 months, following which it stabilized. We did find an average decrease of 2.2 diopters of topographic astigmatism, and this reduction was seen over the first 24 months. In terms of manifest cylinder, we did find a decrease on average of 0.75 diopters, and the stabilization occurred after 15 months. Maximum keratometry values did decrease on average by 3.72 diopters. Central corneal thickness was found to be fairly stable following the procedure, with an average of 4.3 micron thickening of the pachymetry. And ultimately, we found a progression rate of 13%, all with statistical significance. And so we conclude that epithelium off corneal collagen crosslinking is safe and effective in halting progressive keratoconus in children, but also we did find improvements in visual acuity as well as topographic and manifest astigmatism. I think really what this study brings is, our long-term follow-up. Most of the published studies are looking at 2-year data, whereas our study was including 3 years of follow-up. We also did have a larger sample size than the other published studies that are available, and I feel like this really helps in terms of strengthening our findings, for example, with the progression rate being 13%. In addition to being statistically significant, comparing that to other studies that rate anywhere between 5 to 85%, this appears to be a more reasonable outcome. I think the other strength that this study brings, and it really highlights the fact that we need to continue to follow these children after they've been cross-linked, in that progression is real and it can occur. And once we've detected that progression, to consider retreatment And I think additionally, future studies looking at those patients specifically to see how they do after retreatment would be interesting. One weakness of our study is the gender makeup. It was overwhelmingly male. And I feel like that would be something else that would be interesting to look at if there was a more even distribution to see if the patterns are equal amongst male and female. And I think ultimately continue to follow these patients with greater long-term follow-up would be very beneficial, as well as increasing our sample size to see if our results continue to be reproducible. And so that's our study in a nutshell.
Thanks for listening to this episode of the iPod from Ophthalmology Times. We hope you subscribe at iTunes and let us know what topics you'd like to hear more about. Stay connected by going to ophthalmologytimes.com, subscribing to our newsletter, and following us on Twitter, Facebook, or Instagram. We'll see you next time.